Hey everyone, and welcome back. For anyone really trying to understand how a society is doing, especially for those of you gearing up for the UPSC exams, maternal health is really revealing. It's not just some number in a report. It tells you a whole story about healthcare, about social equality, about a nation's well-being overall. And guess what? That's exactly what we're digging into today.
Right on.
We're doing a deep dive into this brand new UN report. It's called Trends in Maternal Mortality, 2020-2023. Pretty straightforward title, huh? But this report is packed with insights.
Oh, absolutely. And it's not just any report. This one comes from the UN's Maternal Mortality Estimation Interagency Group. They go by MMI for short.
MME, got it.
And what's really important is who's behind this MMI. You've got heavy hitters like the World Health Organization, UNICEF, the UNFPA, the World Bank Group, even the UN Department of Economic and Social Affairs. They've all come together to create this truly global picture of what's happening with maternal health.
So it's like the Avengers of global health data, basically.
Yeah, you could say that.
All right, so we've got this super-powered report from MIG, and today's mission is to zero in on India. We're going to break down what the report tells us about India's journey in reducing maternal mortality, what's working, where are the challenges, and what does all this mean for you as you're prepping for the UPSC, especially keeping up with these essential current events in health and socioeconomic development.
You bet. And just to set the stage, I think one of the first things that jumps out from the report is that India is the second largest contributor to maternal deaths globally.
Oh, wow. Second largest.
Yeah, it's pretty significant. In 2023, they're estimating around 19,000 maternal deaths in India. That's about 7.2% of the total number of maternal deaths across the entire world.
19,000, that's a huge number. So who else is up there with India in terms of these, top contributors?
So sharing that 7.2% spot is Nigeria. And then right behind them, also at 7.2%, you have the Democratic Republic of Congo.
So 3 countries all at 7.2%, huh?
Exactly. It's a three-way tie there. And then a bit lower down, but still a significant contributor, is Pakistan at 4.1%. So those 4 countries together, they really represent a big chunk of this global challenge.
Okay, so India's contribution in these absolute numbers is high, but I'm also seeing here in the report that India has actually made some pretty impressive strides in lowering what they call the maternal mortality ratio.
You're absolutely right. This is a really important point. While those absolute numbers are definitely concerning, we also have to look at the MMR.
MMR, right. Just remind us again what that stands for.
Sure thing. MMR stands for Maternal Mortality Ratio, and it basically tells you how many women die during pregnancy or childbirth for every 100,000 live births. So it's a way to measure how safe childbirth is in a particular country or region.
Got it. So fewer deaths per 100,000 births means things are getting safer, right?
Exactly. And the good news is that India's MMR has gone down significantly. It went from 384 in 2000 all the way down to 103 in 2020. And now in 2023, it's estimated to be even lower at 80.
Wow, 80. So that's an 86% drop since 1990. That seems way better than the global average, right?
You're right. The global average decline over the same period is 48%. So India is definitely moving in the right direction and at a much faster pace, especially that period between 2000 and 2020 where India made some really big gains shows how impactful national health programs can be when it comes to promoting safe deliveries in hospitals and healthcare facilities.
That's encouraging to hear, but it's kind of a puzzle, isn't it?
Yeah.
How can India be making such great progress with the MMR but still have so many maternal deaths overall?
It's a really good question, and it comes down to a kind of numbers game. India has a very large population, and every year there are a lot of births.
Makes sense.
So even if the chances of a woman dying during childbirth are getting lower, the sheer number of pregnancies means there are still going to be a lot of deaths in absolute terms.
Right, so it's like even if you shrink the percentage, if you're starting with a really big number, the total can still be high.
You got it. That's precisely why we need to look at both those absolute numbers and the MMR to get the full picture.
Absolutely. So we focused on India, but what about the global trends in maternal mortality? What's the overall picture?
Globally, we are seeing progress, definitely. Maternal deaths are decreasing and the MMR is going down, although it's not happening as fast as in India.
I see.
In 2000, there were about 443,000 maternal deaths worldwide. And by 2023, that number had come down to 260,000.
That's still a lot, but it is a decrease.
Definitely. And if you look at the global MMR, it dropped from 328 per 100,000 live births in 2000 to 197 in 2023. So that's a 40% reduction overall.
That's progress. But I'm guessing those global figures hide some pretty big regional differences.
Oh, absolutely. There are some stark differences between regions. Sadly, sub-Saharan Africa still carries the heaviest burden.
Is that right?
Yeah, about 70% of all maternal deaths happen in sub-Saharan Africa, and their MMR is really high at 454.
454. That's way above the global average.
It is. Then you have Oceania and Central and Southern Asia with moderate MMRs. Oceania is at 173 and Central and Southern Asia at 112.
Okay, moderate, but still concerning.
For sure. And then, at the other end of the spectrum, you have places like Australia and New Zealand. Their MMR is incredibly low, around 3.
That's a huge difference. It really highlights the inequality in access to quality maternal health care around the world, doesn't it?
It really does. It's a stark reminder that geography can play a huge role in a woman's chances of surviving pregnancy and childbirth.
Right. And the report also talks about how the rate of progress is slowing down globally, right?
Yeah, that's a big concern. The pace at which the global MMR is decreasing, it's actually slowing down.
Okay, so between 2000 and 2023, the annual rate of reduction was 2.2%. But from 2016 to 2023, it slowed down to just 1.6%.
Exactly. And that slowdown is especially worrying because of the Sustainable Development Goals, the SDGs.
Right, the SDGs. Goal number 3.1 specifically aims to get the global MMR below 70 per 100,000 live births by 2030.
Yes. And to achieve that, we need to see a much faster rate of reduction. We need to get to an annual reduction rate of 14.8% between 2024 and 2030.
14.8%. That's a huge jump from the current 1.6%.
It is. So there's a lot of work to do. It shows us that even though progress is being made, it's just not happening fast enough to meet that ambitious SDG target.
Absolutely. Okay, before we move on to talking about some of the specific challenges in India, let's just clarify some definitions. I think it's important to understand exactly what we're talking about when we say maternal death.
Definitely. So a maternal death is officially defined as the death of a woman while she's pregnant or within 42 days after the end of her pregnancy.
Okay, so during or just after pregnancy.
Right. And importantly, it has to be from a cause related to or aggravated by the pregnancy itself or its management. So it's not including things like accidents or unrelated illnesses.
Makes sense. So it's specifically about deaths related to the process being pregnant and giving birth.
Exactly.
And the MMR, the maternal mortality ratio, what's the significance of that number? Why is it so important?
So the MMR, as we've been talking about, is the number of maternal deaths for every 100,000 live births. It's basically a key measure of how safe childbirth is in a given area.
Right.
If a country or region has a high MMR, it usually points to problems with the quality of maternal health care.
Like maybe women aren't getting the care they need during pregnancy?
Exactly. It could mean limited access to healthcare services, not enough trained healthcare providers, or even underlying social and economic factors that are putting women's health at risk.
Okay, so a high MMR is a bad sign.
Pretty much. On the flip side, a low MMR usually means a country has a stronger healthcare system for expectant mothers. It suggests good access to care, skilled healthcare professionals, and generally better health outcomes for women during pregnancy and childbirth.
Got it. So back to India now. We've seen that the country's made significant progress in reducing the MMR, but there are still concerns about the absolute number of deaths and the pace of progress. What are some of the specific issues that are being flagged in the report and analyses like those we're seeing in the Hindu?
Yeah, there are a few key points to unpack here. Firstly, India's Ministry of Health and Family Welfare raises a really interesting point about how we compare countries.
Okay, how so?
They argue that directly comparing India's absolute number of maternal deaths with countries that have much smaller populations, like Nigeria, isn't always a fair comparison when you're trying to see how much progress each country has made.
That makes sense. Comparing a country with over 1 billion people to a much smaller country, just based on the total number of deaths, wouldn't really tell you the whole story, would it?
Exactly. But even with that point in mind, India's high proportion of global maternal deaths as a percentage does still signal a significant issue that needs urgent attention. Regardless of population size, it shows there's room for improvement.
So it's about both the scale of the issue in India and the proportion of global deaths it represents. It's a complex picture.
It is.
Now, even though the MMR has decreased significantly, are there still concerns about whether India will meet its targets for reducing maternal mortality?
Yes, that's definitely a valid concern. While India's MMR decline of 6.36% per year between 2000 and 2020 was better than the global average, it might not be enough to reach that SDG target of an MMR below 70 by 2030.
Right. We need to see a much faster rate of decline in the coming years to reach that target.
We do, and the fact that the rate of progress seems to be leveling off suggests that we might be running into more complex challenges that go beyond simply expanding existing programs. It might require some more creative and innovative solutions.
Absolutely. And earlier we talked about global disparities, but are there significant differences in maternal mortality rates within India itself?
Oh, absolutely. There are some big variations from one state to another. Some states are doing incredibly well, like Kerala, Maharashtra, and Tamil Nadu. They've already hit that MMR target of below 70.
That's fantastic.
It is. But then you have other states like Assam, Madhya Pradesh, Uttar Pradesh, and Bihar, where the MMR is still much higher, ranging from 118 to 195.
That's a huge difference. So even if the national average is improving, there are still areas where this situation is really critical.
Exactly. And it makes you wonder what's driving these differences between states. Is it differences in infrastructure, in healthcare facilities, or are there social and cultural factors at play? Or is it about how effectively policies are being implemented at the state level? It's a fascinating question for policymakers and researchers to explore.
So we've got this uneven landscape across India. What are some of the main reasons why it's still so challenging to ensure safe childbirth for all women in India? What are the root causes here?
There are a lot of interconnected factors, but one of the biggest is access to skilled birth care, especially in rural areas and places where resources are scarce.
So even with national programs like the National Health Mission and the Janani Suraksha Yojana, there are still barriers to women giving birth in hospitals or healthcare facilities.
Right, and it's not always about just having a facility nearby. There might be a shortage of skilled healthcare providers like doctors and nurses who are trained in childbirth care. Or maybe there's limited access to emergency obstetric care when complications arise.
That makes sense.
And even today, some of the most common and preventable complications like excessive bleeding after childbirth, infections, and high blood pressure during pregnancy, these are still major causes of maternal deaths.
Wow.
So it's about having timely and effective medical care available when it's needed. And it's not just about having a skilled birth attendant there. It's also about having the right equipment, the right medications, and a system for referring women to higher levels of care if necessary. It's about having the whole system working together.
Right. All the pieces need to be in place.
Exactly. And it's not just about the direct complications of pregnancy and childbirth either. The report and other analyses are pointing to the growing impact of what we call non-communicable diseases.
NCDs, right. Things like diabetes and heart disease.
Exactly. And we're seeing a rise in indirect maternal deaths in India. That means deaths linked to these pre-existing NCDs like gestational diabetes and chronic hypertension. These conditions are becoming more common among women, and if they're not managed well during pregnancy, they can lead to serious complications.
I see.
So it's not just about providing care during labor and delivery. It's about having good prenatal care to manage these underlying conditions throughout the pregnancy. And that can be especially challenging in areas where resources are limited.
Absolutely. So it's a really complex web of factors.
Yeah.
Access to quality care, the rise of these NCDs, regional disparities. Given all these challenges, what are some concrete steps that India can take to accelerate progress and get closer to achieving that SDG target?
Well, one fundamental step is to really strengthen primary health care. We need to focus on making those health and wellness centers, especially in rural and underserved areas, more effective and more accessible.
So making sure women can get the care they need early on in their pregnancies and throughout.
Exactly. Early and consistent care is key.
What about those states that are lagging behind? What can be done to improve maternal health in those areas specifically?
That's where targeted efforts are really important. We need to see increased healthcare investments in those high-risk states like Uttar Pradesh, Bihar, and Madhya Pradesh.
And what would that look like?
It could involve things like setting up mobile health units that can reach women in remote areas, expanding the use of telemedicine for consultations and expert advice, and really empowering those accredited social health activists, the ASHAs, to link women with the services they need.
ASHAs are doing amazing work, aren't they?
They really are. They're often the bridge between women in these communities and the healthcare system.
Absolutely. And there are also successful programs like the Pradhan Mantri Suraksha Matritva Abhiyan, the PMSMA, which focuses on quality antenatal care for adolescent girls, tribal populations, and women from low-income backgrounds. Expanding programs like that could make a huge difference.
Definitely. Targeted programs that address the needs of specific groups can be very effective.
Right, and it's not just about the healthcare system in isolation, is it? It's also about broader societal factors.
You're absolutely right. Policy integration is really key here. Maternal health can't be seen as separate from other development goals.
Like gender equality and reducing inequality, right?
Exactly. We need a multi-pronged approach that tackles the root causes of these health disparities. That means improving women's overall status in society, educating communities about maternal health, and addressing things like poverty and gender-based violence, which, even indirectly, can have a huge impact on maternal health outcomes.
It's about empowering women and creating a more equitable society overall.
Absolutely.
And finally, to track progress and make informed decisions, we need accurate data. How can India strengthen its data systems in this area?
That's a great point. Having reliable data is crucial. We need to make sure births and deaths are being registered accurately and promptly.
Through platforms like the Civil Registration System portal, right?
Exactly. The CRS portal is really important for getting a clear picture of what's happening with maternal mortality.
And using digital platforms like the UW platform, which is being used for immunization, could be a game changer for tracking maternal and child health indicators in real time.
Absolutely. Imagine being able to track these indicators in real time and use that information to target interventions where they're most needed. That could be incredibly powerful.
It could be transformative. So for those of you listening, especially those prepping for your UPSC exams, here's what we've learned today. India has made some really impressive progress in reducing maternal mortality. It's a testament to the efforts that have been made.
It is.
But the sheer number of maternal deaths is still very concerning, and the rate of improvement needs to pick up significantly if we're going to meet that ambitious SDG target. Understanding those regional disparities within India and realizing that we need a multifaceted approach that goes beyond just healthcare are key takeaways for your preparation.
This deep dive into the UN report, which we're discussing based on reporting in the Hindu, has given us a much more nuanced understanding of this really important socioeconomic and health indicator. It shows us both the successes and the ongoing challenges, and that context is invaluable for various parts of the UPSC syllabus, from current events to social justice and public health.
And it brings us to a thought-provoking question for you to consider. How can India build on its past successes and tackle those remaining systemic challenges to achieve truly equitable and dramatically reduced maternal mortality across all its regions?
It's about thinking about how to translate policies into real improvements in the lives and health of women all across the country.
Exactly. It's not just about understanding of the problem, it's about figuring out how to create lasting and impactful change on the ground. And we truly hope that this in-depth look at maternal mortality trends, based on the UN report as reported by the Hindu, has been helpful for your UPSC preparation.
We hope so too.
And if you found it helpful, or if you have more questions, please do like this video, subscribe to our channel, and leave a comment below. We love hearing from you. Let us know your thoughts and any specific topics you'd like us to explore in future discussions.
Just as a reminder, the information we discussed today comes from the United Nations Maternal Mortality Estimation Interagency Group, or MMMI, report, as reported by the Hindu. Thanks for joining us.
See you next time.